All right, welcome to a Wisconsin Department of Public Instruction's Social and Emotional Learning Assessment webinar featuring CoVitality. My name is Terry Lesage and I'm an education consultant here at the DPI. A few notes on how this webinar will work. First, note that this webinar is being recorded and closed captioned for future use. Second, everyone but the current speaker is and will be muted. However, if time allows, you can unmute at the end of the webinar so you can speak directly with the presenters. Third, it would be great for everyone, including our presenters, to know who is part of the conversation today. So if you would, please take a moment to share your name and school district or agency in the chat box. I see some people already doing it. Thank you. We would all like to know where in Wisconsin everyone is. You can find the chat feature by moving your cursor to the bottom of your screen and clicking on the chat icon, which looks like a small speech bubble. Finally, as we move through the presentation today, please feel free to make use of that chat feature to ask questions or make comments. Although, as I mentioned, you can speak aloud at the end of the presentations, we don't want you to lose an important thought while waiting for the end of the presentation. I'll be monitoring the chat box as we move through the webinar and will respond as I can or prompt the speakers. And I know some people have already asked a couple of questions, so I will circle back to those questions in just a moment. I'll now share a bit about what you can expect to learn today and who will be speaking from CoVitality. So CoVitality is a researched, validated, and empirically supported strengths-based SEL screener. In today's webinar, Alepa and Katie Ann will review the CoVitality framework and how this assessment tool and easy-to-use online platform can aid educators' efforts throughout our state of Wisconsin to measure and improve the social and emotional competency of your students. Developed at the University of California, Santa Barbara, UCSB, and funded by the Federal Institute of Education Sciences, FIES, CoVitality is a positive psychology-based assessment designed to identify students' key psychological strengths or assets known to contribute to your presenters today. Well, social worker, Alepa brings an authentic practitioner today. Her work in behavioral health at CMC Behavioral Health in Charlotte, North Carolina, Mental Health Center in South Carolina, the Willows at Amethyst, North Carolina, and the Family Center in North Carolina, now Alexander's Youth Network, has uniquely positioned her to speak on CoVitality's real use case studies and potential. Having worked with adults, children, and families in a variety of clinical settings, including with public and private school systems, she has an enhanced ability to service the social and emotional needs of students, teachers, and staff. Katie Ann has a passion for producing positive behavioral health outcomes. In her role as impact producer, she helps to drive continuous improvement and innovation for CoVitality clients nationwide. She joined the CoVitality team as an advocate for social and emotional learning, and as a researcher and behavioral technician, her main focus has been helping administrators bridge the gap between data collection and student intervention using a valid psychometric instrument. And with that introduction, I'm going to hand over screen control and the presentation to Alepa and Katie Ann of CoVitality. So give everybody a moment here while they pick up the screen sharing. In the meantime, feel free to keep introducing yourself as you join us in the chat.
Yes, and thank you so much for that lovely introduction. Everyone, we are so happy to join you today. Thank you so much for taking the time out of your day to come and hear what we have to share. We're very excited to present how CoVitality's domains align to the competency requirements for the Wisconsin Department of Public Instruction in your state's effort to improve social and emotional learning. I'm here with Katie Ann as well. Katie Ann.
Thank you so much for that introduction, Teresa and Alepa. It's great to be here with you all today. And I really want to also salute you all as the part of your state's crucial leadership. We really are proud to be here and show you how our tool can help you effectively implement and apply your SEL practices across your state. But by taking on this important, we're all at the forefront of innovation and addressing the social emotional needs of all children. And we just want to take a moment to acknowledge that.
Also, so to begin the webinar, we want to go ahead and review the CoVitality framework and discuss how our Universal SEL Screener is an easy-to-use online platform that can facilitate educators' abilities to effectively measure and improve their students' social and emotional well-being. Throughout this presentation, we will highlight how educators and professionals can utilize CoVitality for implementing a comprehensive approach to SEL. CoVitality will provide strong and crucial data to support assessing SEL competencies so that you can understand your students' overall well-being. Our framework is designed to cure intervention with prevention. We encourage a shift away from the typical wait to fail or teacher referral system. CoVitality highlights strengths and deficits with evidence-based results generated from the research-validated SEL assessment. Results can be used by educators to equip students with the skills they need to successfully manage and resolve challenges now and for the rest of their lives. So let's take a brief look here. We do have a definition of social and emotional learning. This is the process through which children and adults can acquire effectively and apply the skills to their wholehearted living and find a way to connect. We understand that managing emotions and understanding emotions is so critical to all ages of people. We understand that there's a great value in setting and achieving those positive goals. We understand how important it is to feel and show empathy for others, especially in these uncertain times with all these challenges. We want to make sure that children and adults can establish and maintain those positive relationships with one another. And of course, we always want to encourage everyone to be making as responsible decisions as they can. So very important stuff. One of the biggest things that we've discovered through the research of SEL is that one of the things that we have seen, especially from a study of over 270,000 students, when they participated in evidence-based SEL programs, they showed an 11% gain in academic achievement compared to students who did not participate in SEL programs. As I'm sure all of you can imagine, normally a 5 or 6% gain is great, but to get an 11% gain was something that was very eye-catching. And we're so excited that we're able to have this discussion at this time because it brings a better balance to attending to the whole child and the whole student while we help them academically achieve, but also socially and emotionally.
So how do we go about doing that? Modern day approaches working on this SEL implementation, these programs usually utilize deficit-based assessments, which we've identified several issues with. They are often focused on problems. They're often not research related. They over-identify these externalizing behaviors, the ones you're usually already aware of as educators who work closely with these students. In addition to that, you don't have results available right away and usually are not given specific follow-up strategies that speak to those SEL skills and how to help students improve on them. And that's where CoVitality comes in. So CoVitality is focused on personal strengths. By assessing students' strengths, you can point your staff directly to areas where they can improve and receive support to build on these skills. This will conserve valuable class time and your support resources, and it also helps you target specific support to areas where students can improve strengths. So today we'll be walking through the features of a CoVitality platform. We're really excited to show you all the vast potential that our tool can bring to the table to help you support your new initiative. And first, we want to talk a little bit about the tool and how it's developed. Like Teresa mentioned, many of you are probably familiar with UCSB as well as CASEL. They're the Collaborative for Social, Emotional, and Collaborative for Academic, Social, and Emotional Learning. And their commitment to advancing equity and excellence in education through social emotional learning is something we really believe in and champion as well. So in addition to Wisconsin's competencies, CoVitality aligns to CASEL's integrated framework. And the strengths it's designed to measure can be taught in many different ways across many different things. So CoVitality, like we mentioned at the beginning, we are the world's most research validated and empirically supported SEL screener. So let's review the framework and how our assessment tool and our easy to use platform can aid these efforts throughout Wisconsin and measure and improve your social emotional competency of all these students. So we were developed at the University of California, Santa Barbara, funded by the FIES, like mentioned at the beginning, but we really are a true positive psychology-based assessment bred out of that literature at the Gervitz School. So this assessment is designed only to identify those key psychological strengths, those assets, factors we know contribute to that long-term thriving well-being. And our study CoVitality has been published in over 35 peer-reviewed journals. Their survey uses the world's best social science research to assess the mental health and overall well-being of your students. And as in your state, lead author of our assessment tool, Dr. Michael Furlong, has closely collaborated with leaders in the SEL community, and he spent years at the forefront of innovation and advocacy for implementation of standardized SEL assessment tool that can go ahead and measure these essential skills for educators to help. So through expert review, alignment of 12 CoVitality strengths to your state's SEL competencies has been vetted by some of the premier SEL experts in the country. And these are the researchers at the University of California, Santa Barbara Gerbert School of Education. Our survey measures 12 personal strength assets across 4 domains seen here in this graphic. And these are the factors that have shown to be the most important or crucial to a child's identified through the literature to their social emotional well-being. These key mindsets have been extensively studied, and they're also correlated with positive development. As you can see here in this one-to-one correlation on the right-hand side, social competence, Wisconsin's domain, many of your domains directly correspond to skills for learners as set forth by your Department of Public Instruction. For example, optimism, zest, and gratitude encompass the engaged living domain. These strengths are described as skills in your self-concept competency for learners in the state's guidelines. What you're seeing here is emotional development, other strengths that are corresponding to skills for learners in your state. This is comprised of self-control and empathy, which we call emotional competence, which you call emotional development. We also have social competence that you call, which our domains comprise family support, peer support, and school support, which also applies to your skills for learners. So we've listed below a couple example of questions that your students will answer for each of the surveys. It's important to note that CoVitality presently covers grades 4th through 12th. The primary version of the survey for students is 4th and 5th grade and includes the same questions simplified in age-appropriate language. And CoVitality is a student self-report survey questionnaire, so that also meets the criteria for your new competencies. Students rate their own abilities, taking the survey online using a web link provided by educators that's unique to your school and can be found in the dashboard. Once they use the link, they navigate to the survey, complete that 36-item question assessment, exit out of the window, and their job is done. So we've collaborated to create this really robust technology platform that allows the screener to be easily administered online. And the time it takes is only about 10 minutes. So additionally, the next level of that is adding that web-based application. It's intuitive. It works with your school staff based on their workflow to efficiently monitor administration and completion screener, while also allowing you to view those student results in real time of those domain strengths, the areas that they might be struggling. So once students complete the screener online, results and reports are generated instantaneously. No longer do you have to wait to see which students need immediate help. But last and not least, it's all transferred right into the app and it's protected using HIPAA and FERPA standards to ensure confidentiality. Each site has their own login to view results and generate reports on their own set of data. Then at the district level, district staff can have their own login where they can view data across all school sites in the district. District staff also have access to aggregated reports that present results across all schools, along with school comparison reports. As you can see, a button in the slides above to log into the CoVitality platform and find the links for each school to complete the survey administration. Educators who are participating in the CoVitality administration process and leading the implementation will be provided a user activation email, and that contains the instructions to create their username and login. Once they've verified their accounts, they'll also be provided a URL. It takes them to a landing page where they can input their credentials and access the dashboard. So this is what the dashboard looks like. You're seeing this right here where you can monitor their administration, you generate all your reports, you have a risk group monitoring table that's doing as students are coming in, how they're falling into those various domains, which strength areas can be improved on, which competencies you can go ahead and hone in on as an area of need, individual student level, school level, and district. So now that I've talked a little bit about the dashboard, a little bit about the application and the research, I want to show you the great value of the CoVitality reports. So
And
right,
Katie Ann, there was a request in the chat to just slow down just a little bit.
Oh, sorry about that. Sorry about that. I am definitely a fast talker. Alrighty.
And if anyone would like for us to return to a piece, we will happily do that during the Q&A. So no worries. We've prepped this so that we give you guys plenty of time to ask questions. Thank you.
Definitely ample time at the end. We'll revisit a couple things if you have questions about that. So right here, after the dashboard, in the dashboard in this upper right-hand area, you have a reporting module area. So we categorize students based on their level of CoVitality strengths. CoVitality also includes a measure for psychological distress, life satisfaction, and school connectedness. So the composition of all those scores will generate a student profile. We triage these into risk groups. They are color coded. The individual profile report is based on the combination level of psychological distress and number of CoVitality strengths. So we're not looking at deficits, but we are asking about other factors of well-being to make sure that we can get a holistic view and understand which strengths can be improved. All strengths are present, which ones are in which levels. So red report are students who report a high level of psychological distress and a low number of CoVitality strengths, and we consider those high risk. So our recommendation is following up right away, and we've color coded this accordingly to be that visual indicator. We also have our blue reports, students with a moderate level of psychological distress and low to mid level of CoVitality strengths. And these would normally require some follow-up to improve their skills as they are not yet showing up as strengths. So giving an idea of where we could go ahead and target that competency for that student. If they're a blue report, they're showing lower levels, we can get those into the strengths area, show performance across years, and get them to being a student with a green report, because green reports, that is going to be our high thriving group. Those are students indicating that they're showing strong CoVitality strengths, not requiring support or intervention. It is recommended, however, to keep reinforcing these skills that students are showing on the student profile report. So one of the other exciting reports, lastly, we want to show you is the school climate report. This shows student SEL strengths and data easily presented in a format for everyone to understand. So be it a teacher, a counselor, an administrator, even parents can understand the ways in which they can support students meeting SEL competencies. And there's data for the entire site available for stakeholders in an easy to digest report. So that said, we want to pull up some of these reports right now to go ahead and show you. So I'm going to pause that right here and bring up some examples of those red, green, and blue reports. So we can dive really just into the details of where CoVitality strengths are showing on the reports and how that will align to a competency you can work on. So give me just one moment here. We've got.
And thank you everyone for your patience. Katie Ann and I are very excited to be here, as you can tell in our speedy presentation here today, but we will leave plenty of time for any questions, and we're happy to revisit any slides.
Alrighty, so what you're seeing right here on my screen is that red report. This is a CoVitality.
Katie,
yes.
It's not showing the red report.
Oh, you are not seeing on my screen. Now you should be seeing one.
There we go.
Yeah, so this is going to be a high-risk student. As you can see, the results of CoVitality survey will categorize the student. They are showing psychological distress and they're showing low CoVitality strengths. So what we've done here is put all of the results, all of the domains into a really nice couple pages that is a printout report you can have available for anyone who's interested, anyone who works with the student, to understand the areas that they're struggling, understand areas for growth, areas to enhance, struggling areas we think of, and then which areas they actually are showing strengths in. It's ideal to get all students to have areas to enhance and areas to growth eventually fall into the strengths column, but you can see how they are all listed here with the student's name, their grade, the school that took the survey, the date, and if the responses are valid. So this report's really designed to be incredibly easy for anyone to use, anyone to be digesting these results, regardless of your background, regardless of your familiarity with SEL in general or research or assessment. So gone ahead and put all the CoVitality core domains, as well as the subdomains they fall under, with a really nice definition, so you can get a sense exactly of how that's going to look in comparison to the competency. And what we have down here, some raw results, again, just really going to that next level of providing everything for you. And these are downloaded in the application. So they're available, not going to be mailed to you 6 or 7 months later. So you'll see the definitions of the core domains as we go down, and a brief.
So Katie Ann, excuse me for interrupting. We had a question and they were asking about strategies and interventions. So we will gladly show you for that as well.
Definitely. Yeah, so again, just the last couple pages here, we're really just making sure all this analysis is very fleshed out for people, regardless of their level, and then just giving you the scores, interpreting them doing that little bit of results analysis for you. So what we have to do after that, got a report, you've understood now, okay, we have a student, they're struggling in ABC area, those strengths correspond to our strength areas here, but how do we improve on those areas? How do we target them? So the custom follow-up strategies are really a huge value of the tool. They're available for download as well in the application, and they look like this. So if you're seeing my screen right here, is that in the classroom? This is going to be a one-page report. This is all the literature from the field. We worked really closely with our research team to go ahead and take an analysis of what's going on in the field. What are these easy evidence-based strategies that are able to put in the hands of educators, be implemented in the classroom, either on individual and group settings? And how do we message that to the person who's going to have that read report and want to be working on that strength area? So the student who has an individual report and it's showing a strength area that needs to be an area for growth, they will have one page printout for every strength based on the areas that are in need. So the students, like we saw before, they only had one area, only one strength, but there was many areas in the areas for growth and areas to watch column. So if there are, say, nine domains, 9 strength areas that correspond with your competencies, we have 9 reports that are 1 pages, just custom follow-up strategies. How do we implement tools and things with these students in the classroom to work on that specific strength area, that specific skill? So you can see here, it'll be couple activities. We've got hyperlinks to additional things. We also have all of these on our website as well, and the future of the application. And as we continuously take in new information and new things are published, and I know as you folks are all probably well familiar in the era of COVID, being very inundated with resources, our team works to sort through those as they come in and continuously post things on our website, keeping that resources page really robust for additional strategies that speak to our strength areas and how to implement things to help students in the classroom.
So Katie Ann, we had a question come up about how it's modified for students who have deficits in language. And I wanted to go ahead and just add here that currently the survey is available in English and in Spanish. And these are all excellent questions, by the way, and we really appreciate it. When we prepared this demonstration, we didn't exactly plan to do a demo for all of you because then we would dive into the very specifics. But when somebody has a language deficit, if there's an interpreter available and they can just read the question and translate it, some schools have done it that way. Sometimes if it's a parent or teacher, the language is very simple. Katie Ann, if you could bring back that slide that has the questions that the students answer. You know, these are very simple sentences. It was not designed to be tricky. It is not designed to make it difficult for students to answer questions, but definitely that can be a challenge. I can see when students either have learning difficulties or language challenges.
Yeah, that is a great question. I do want to point out here, if you're seeing my screen, this is what the students see when they're taking the survey. This was a unique link that they were given at their school site by their administrator, potentially in the district. And in the upper left hand, you can see we do have 2 translations of the survey. Just to note, it is available in English and Spanish, but this is what it looks like. Like Lepa mentioned, the language is pretty straightforward, fairly simplified, but we have had districts in the past work with anyone who they have as a support staff an additional resource to go ahead and be already working with those students, just sit with them when they're taking the survey. That's what I've seen with the clients I've worked with, but that is a great question. This is what the survey looks like, and there is Spanish translation up here.
Are you in the survey? Can you show them some of the questions? Yeah, let's just walk through so they have a sense.
Yeah, so at the beginning of the survey, we start out with some demographics.
And I believe the reading level is 5th grade.
Yes, that's correct. Asking about demographic questions, really just to get that next level analysis. We have a student assent question. We really believe in the power of self-determination, self-choice. We also have parent and teacher consent letters that we help work with our districts to customize for their group of stakeholders they're trying to get buy-in from. But we also always ask the students as well, because we think, you know, you already have to take a lot of assessments, and we really want them to know that this is something that's done for them and it's designed to be a positive experience. There's validity check questions throughout the survey. This one, last time we were seen by a dentist. Most students are not going to hit 5 or more years. So there's various things, measures embedded within the tool and within just the research itself through its validation, as well as our actual application, that try to highlight and flag and mark those students as either their time or which responses that they might not be answering honestly, because we really want to make sure that you get results on every single student, because we don't call it a universal screener for no reason. So you can see really phrased in that positive language. So working out your problems. And at the upper right-hand corner, you can see there's a progress monitoring bar, just a nice reinforcer letting those students know how far along they are in the survey. And we mentioned this before, but this usually takes, if you're answering truthfully, about 10 to 15 minutes. There's 36 items administered through this web link. And as soon as they're done and this bar fills up, they just exit the window and their survey is instantly recorded. So that is when you will have in your dashboard, the progress monitoring will go up. You'll see, oh, we're getting close to all of our surveys are completed. You maybe have some school psychologists on staff, some additional resources that you've gotten a grant to come in and help maybe 1 day a week. And as you're seeing results come in on these students in the dashboard, the surveys are getting taken, be it virtual or in class, you can have an idea of where the strengths are starting to fall within your students individually and on that school site level. So if you had someone that's coming in once a week and you have this access to a dashboard, that snapshot, even if you haven't had a complete survey administration and all students haven't been done with their survey, you can have someone going in and helping right away just because the results come in instantaneously, which we think is a very valuable aspect of the tool, because we find oftentimes when you have resources, you want them to go where they need to go right away, and their need is definitely there. So knowing where to help is sometimes half the battle. So asking about disabilities, we're asking, and we also have a school climate report as well. Life satisfaction skills, a slide down. So we ask students to enter their student ID numbers. We have had districts do this anonymously. If you are starting, really depending on where you're at, I mean, if you're at that level where you're just building an MTSS system, you're just starting to do tiered supports, and you really have no idea where to start and what that baseline level of need is in your student population, that's what the reports and results are going to be really good at giving you, is that snapshot of, okay, on this high level of our whole school, we've got 12 domains, and if everyone at this school is struggling with optimism, we know that that's going to be our tier 1. Let's do an assembly. We're going to embed those supports, because if you don't really have an idea of the state of the pulse of your population, it's kind of harder sometimes if you do have all these grants and additional supports that are waiting to be utilized, to know how and where they need to be utilized. So
we had another question come in, Katie Ann, and I know that you won't be able to see it, so I'll just say, it says, how often should the students take the survey during the school year, and will the questions become individualized based on their previous results? So a lot of times schools, depending on what your needs are and what your goals are, you can do a pre and a post. A lot of folks do a spring and a fall. No, is it? Yeah, spring and a fall, or fall and a spring, sorry guys. And so they, like to have that data, but if you get an unlimited access, you can do it as often as you like with whatever population you choose as you identify it. And then as far as the questions becoming individualized based on their previous results, you will have the previous results listed. And if you look up your student, let's say you're using student IDs and you look up their last results and this results, you can look at the reports and do a comparison. Katie Ann, you can add to this if you'd like, but I see.
Yeah, definitely. So want to just note here, I'm logged out. I accessed that survey link to show you all the survey through the platform, but I was logged out. That's a security feature. If you leave your desk for more than 5 minutes, you will have to log back in. And like Lepa was mentioning, you want to go ahead and look at those students in their caseload, and you want to see their results maybe from fall and spring, pre and post test. The dashboard is the main page that you do come into. And on the left-hand side, you can filter all your student load using this link right here. But you can also access the students as they're categorized in their risk groups, like I was talking about earlier, and for monitoring, and maybe you want to follow up, we're only at 92% completion right now. However, we might have someone, and we can see right here, 13 students in our highest risk group. If you click that hyperlink, you'll have a pre-filtered list of all the students that are in that highest risk group. You can download all.
Katie, you're still on the survey. I don't know if you.
Oh my gosh.
Yeah, and also we had a couple other questions. Katie, can you go ahead and just look at the chat real quick, and then we can pause.
Yeah, let me find it. Of course, let's see. Chat. Okay, so let me scroll up here. Out.
So we had a question about putting it into EduClimber. For instance, like our map testing scores can get loaded into our student profile in EduClimber.
So that's a good question. And this is something we actually get asked a lot by schools and districts, and we're working on. We don't have any custom APIs or any integrations. We don't do any front loading of your data, but our team is right now working on ways that we can be able to integrate with systems like Power BI, like Canvas, like EduClimber. But we do have in the dashboard, I want to show you right here, in the reporting area, is everyone seeing the screen before I start? Okay, good. So upper right hand, we got our reporting. You can see these kind of light pink tannish bubbles. We've got data export. So this is actually very different from many companies in that we believe all this data is yours, all this student data. So everything that you've collected, you can generate an PDF or a Excel file of all of the data, all the results that you just collected in raw form. So what we've had is on that next level, the school site staff, maybe have a person who's very into data. I'm that person on our team. So they look and say, okay, I've got that raw data export, and then putting it into your system just comes from that process and at the next level to do other reports.
And we also had a question about, does this have a, yes, measure?
I don't believe so. We have a sincerities of responses, but I don't believe so. And then we see someone's asking about cost. So we cost per student, and we have the option. It really depends on your needs. We work really closely with our districts, mostly just because they do have we see such differences state by state in the way that these things need to be configured for them and the way they want to go about doing the administration. So it depends on the number of times that you'd want to administer to the student. It is costed per student. There's a couple, the price breakdown is licensing and software fees. Then we charge for the setup, the technical assistance, the reporting, and the training. So those are each per student. And the surveys are included in the first number. And I believe it works out, it depends on how many customizations you would want, but it's about like $5.35 per student. Don't hold me to that number because
$5.30.
Oh yes,
we want to
$5.
clarify.
I did have that happen. So, yeah, yesterday a person thought I was saying $535. So no, it's about $5.35 per student. And then there are those setup and training fees, but we work based on a case-by-case basis and any custom needs to really adjust that cost for you. Did I miss any questions? I'm going to scroll up and look at this chat window now. And okay, I'm not seeing any more questions at the time. Did I get everyone's, the ones that I had missed? Okay, good. So go ahead and show you the school climate report, because we talked about that a second ago, and how if you're just starting your program, you would see, so we have competencies, we have domain strengths, we've got our risk groups that are based on those things. And if you look at the school climate report, here's an idea, here's a snapshot of where those students are within those risk groups. We've got at this CoVitality High School, it looks pretty even distribution here. We've got our high thriving groups, that's great. That means 73 students, you can see that small number in there, are thriving. Our down at the bottom, our high risk is about 13, but just a really nice way to just get a snapshot of how is our student population doing? What is the pulse? What's the read? And then if you go down, you can see all those explanations similar to the student profile report. This one is on the aggregate school level, but we have all of our domains, that definition again, but how many students in exact percentages are falling into that category and showing that as the strength at your site for every domain, every question. So this isn't just an easy way to get an idea of, you know, here we can see, and I said optimism because it's such a frequent example we encounter that's low amongst students. It's a little disheartening, but optimism, you can see right here at this school, only 13.71% of students at CoVitality High School are showing optimism as a strength. And that's, you know, not great, because that means 50% of students need to enhance that area. So the goal is to have everyone showing high scores in strengths, but through this snapshot, you can get a better idea of which ones are the most immediate need on your school site level if you don't necessarily have the resources to follow up with individual students. And then again, we've got this life satisfaction and the school connectedness, that next level of interpretation here.
And
exit out there.
we are more than happy if anyone is interested to follow up with you. We will add our contact information here at the end, but Katie Ann can schedule a demo where we go much more in depth with all of this. Today was just more so an overview to show how we connect to the Wisconsin competencies for SEL, how we can try to align with what you guys are trying to do there, and how we can support you in achieving those goals. And so Katie Ann, thank you so much for running through that. And again, thank you guys for your patience with us as we set the pace. We are more than happy to answer any other questions if anyone else has anything to share. We do have the CoVitality website. It's www.covitality.com. Katie Ann's contact information is here. Her email is probably the best way to reach her, but we do have a phone number as well. And we really do thank you so much for your time. We are honored that you invited us, and we are excited to share that we have a tool that we hope can be a resource and something that can be a game changer in the community. The districts that we have utilizing it right now have been very positive in their feedback. It has worked very well in a remote setting. A lot of folks have asked questions about how to conduct it because it is web-based. It can be done on any device. And so, again, we're happy to answer any more detailed questions if anyone would like to ask.
Yeah. Oh, does this stand for on their website? That's a great question. So it stands apart in that it aligns as we're sort of all kind of measuring and talking about the same domains, the same kind of core areas of they loosely shake out in a similar manner, regardless of what assessment you're using. However, the difference is just that we're giving you the results and the reports and that next level of what to do with the results and the reports once you have an idea of where that student's struggling. So different and the same in the sense that we give you right here, and let's go back and look at this slide too. So just everyone can be looking at it while we're talking about it. So what we've done here, you can see we've got a Cassell domain, we've got your domains, and then you can see with CoVitality, we're corresponding in this area to optimism and self-awareness. So you have your DPI, you have your tool, you can see how everyone is doing on your scale. But if you want something to be able to target those specific skills and then have ways to follow up and have results in a way that you can disseminate them to many people at the same time, and in a way that's easier to understand for the whole group, that's really kind of the key difference. Is just that you have the data in hand, you have it in a way that it's going to be analyzed for you, and then you have the option to download those reports right away and give them to all the people who might not have either been in the initial webinar, or that they're just someone who's comes in every now and then to help with students. It really is the key kind of difference.
And thank you. Those are excellent questions from all
there's
of
a
you.
really
So
good.
don't be shy. We do have some time, so we're happy to answer anything that may come up.
And look at this slide too. We've aligned here. We've got empathy aligning very closely to your peer support domain. And some measure details here as well, just about CoVitality to the left. If there's questions a lot of times about these things, the administration time, items, how do they take it, student self-report, that kind of thing. And I'm going to turn my thing on so I can see up here. Okay. See any more in the window?
You can put that Q&A slide back up. That does bring us to the end of our presentation today. We thank you for letting us bounce around a little bit as we try to answer these questions. Was there any other last call for questions? All right. Let's see. So Teresa, I think we're ready to pass it back to you.
All right, everyone. Thank you so much. Yeah. Sounds good. Contact information is right there for you for everybody that's still on the line with us. As I mentioned in the beginning, this webinar was recorded. It will be closed captioned. I will post it on the Wisconsin Department SEL assessment webpage. I had put the link in the chat box earlier. There you can also find the alignment tool that CoVitality has created to show how CoVitality complements and enhances the Wisconsin SEL competency. So take a look at that. Otherwise, we have another
I lost audio. Shoot.
Another webinar next
Oh,
week
there
featuring
it is.
another assessment. Guys, thank you all for joining us.